All right. Well, good morning, everyone. I've got 9 o'clock. It is April 7th. Thank you guys for being here live on the call. I hope you guys missed me. Had needed some much time off, some PTO, if you will. I've been burning the candle at both ends. So I appreciate the team covering for me for the last couple of weeks here, and we're back at it. So very excited to go through what we have today. We've got a special guest that'll be on the line in just a few minutes. We'll give him the mic, and he's going to share with you some of the new products that we're exploring and making sure that we're doing everything we can to essentially, be the best agents we can and create long-lasting relationships with your clients. And this is one way to do it. So with that, as a reminder, we are here this morning and always to improve the lives of our community with affordable healthcare. So thank you guys for being a part of that mission. And thank you for being here on the call live so you can be your best version of yourself. So we really appreciate that. All right. First thing is I'd like to share with you guys, starting off a little bit different. I'm going to share my screen here. So as a reminder, if you are on your phone listening in, thank you, but you are going to be missing quite a bit of information if you just join by phone. And I know many of you are just used to that because that's how we started. But moving forward, I highly recommend those of you that are on your phone, I highly recommend that you join on a computer or iPad or laptop or whatever, so you can see what we're doing here on the screen, because this is going to become more and more important as we share with you all of the good news and stuff that we've got going on. So with that, I want to share with you another tool that I've been using lately for just, making sure I'm being more centered in life in general. But in sales, we get pulled in so many directions. Clients often, test our limits, find the fences, if you will. They sometimes make you angry, sometimes make you sad, whatever the case might be. So one of the tools that I've been using is meditation. And I've been doing this for many years. And so I may have talked to some of you about this in the past, but this is a software that I use called Headspace. And in this thing, it's got an app, and you can download it and, help yourself explore meditation. I can tell you, I feel like a very different person when I meditate. So it's a fantastic tool. I wish I had found it years and years ago when I was in sales, because I feel like, instead of reacting to situations, you can respond calmly. And that makes all the difference in the world. So I wanted to share that with you guys this morning as kind of like my productivity hack, if you will, to share with you guys, one of the secret successes for what I've been doing. People ask me, like, how do you stay so chill with everything going on? And this is one of those secret weapons that I have. So Headspace is just a software that you can use. They've got free stuff on there. But in general, it's just meditation. You can find free YouTube videos and things like that. But I found this is incredibly helpful because it's in your pocket, and you can use it anytime. So there's other apps out there too, but I figured this one might be worth checking out. So with that, let's jump over to HQ in the training calendar. We're going to go over to learning, and in HQ under training calendar, you're going to see what's going on this week with training. So I'm going to punch up the weekly calendar here. Here we go. And just share with you guys what we have going on this week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. Training is essential. It is absolutely necessary for you to know what the heck is going on out there, because there's lots of changes happening. Okay. So later this week, later today at 1:30, United Healthcare is going over the 2025 Part D program. If you are in Medicare, if you are doing Medicare sales in 2025, you must be able to master the Part D program. It has changed. If you don't know how this works, you're going to get yourself in trouble. So I highly recommend that you join a Part D program training, United Healthcare. Very, very good training. That's at 1:30 today. Cigna's doing leveraging low income subsidy to help more customers. Remember, we're in lock-in now, so you need new opportunities to capture clients or to sustain your clients to get you through to AEP. And learning LIS is one of those secret weapons for you. Tomorrow at noon, Cigna's doing lead gen, United Healthcare Medicare supplement training at 1:30. If you're looking to get into subs, good time to do that. And then Cigna, how they're doing with their dental, vision, and hearing. We're going to talk about dental, vision, and hearing today. I can tell you that much. 9 o'clock, we got our very own Al Clancy at 9:30 doing our virtual coffee and chat session. Again, he's our internal coach. If you're feeling lost, confused, upside down, inside out, this is the guy you need to talk to. 9:30 on Wednesdays. Cigna dual SNP training and retention at 10 a.m. You can check that out. Spark is doing how to maximize your Medicare sales with SEPs. We had talked about this. That's a special training at noon on Wednesday. Check that out. I'm going to show you some secret weapons here at Spark. One of the reasons why we partnered and used their software. We're going to show you exactly what's going on there. United's got 2 trainings back-to-back on Wednesday, one for grassroots at 1, and then their dental and vision hearing products for MA and MAPD at 2 o'clock on Wednesday. Are you guys seeing a trend here? Right? It's the way the world's going. Thursday at 10, we've got Susanna from WellCare. She's going to be in the office on Edgewater at 10 a.m. If you're in the Orlando market and you're looking for a little bit of TLC and help, she is fantastic. She will be able to help you level up your business. United's got DSNP training at 11 on Thursday. Cigna's got open office hours at noon to call in. And then we've got HQ training. This software I'm sharing with you right now. If you don't have HQ, please reach out to us and we will get you hooked up with that. We've got shop training, our Medicare Advantage training. That is on Friday. However, I do want to make an announcement. This Friday, the 11th, is Health Plan Market's birthday. That's right. It's our birthday here at HPM. And so with that, we are going to be closing the office and giving everyone the day off in celebration of, I think it's 12 years now. Yeah, that's it. 12 years. We've been around. So it's our birthday on Friday, so we're going to be closed. However, there are a couple trainings that you guys can jump into. United doing the low income subsidy training at 11 and then closing the sale at 12. So that's a training for the week. Remember, guys, keep one foot in the classroom and the other one in the field at all times. Now, we're in HQ. I want to show you something really cool here. Fernando made a huge update. If you go down to enrollment tools and you click provider search, bam, we have provider search using Spark's platform as a link out specific right from HQ. So you don't have to go searching around for it. So one more time, from HQ, let's go from the home page of HQ. You landed on the home page there. Enrollment tools, provider search. Bam. How easy is that? And this has all the providers, all the health plans, all in one place. So you can check that out. All right. Let's see. Other cool tricks on HQ. Just remember that we're posting blogs about once a week on here. So if you want to check that out, the most pertinent information is going to live on the home screen here. Our idea is not to jam you up with another email. I know I get about 500 emails a day. I get it. So this is just one of those places where you're like, hey, I really need to know what the heck is going on. You can log in and see what's going on here. Okay. There it is. Let's talk about Spark for a second. The Spark platform, if you're unfamiliar with it, there's going to be trainings, but I do want to share with you that they have a help center. You can find that in HQ under resources, and then the Spark Help Center here to get started. The platform is just unbelievable as far as keeping up with your clients. Those of you that have enrolled in The client services perspective, you can have your clients touched with a monthly newsletter. You've got birthday cards that are sent automatically to your clients on their birthday, and we've got our incredibly successful AEP survey campaign that gets launched in September. So I did the math, and on the first year that you enroll a client, they get touched. If you signed up for all of the automations in the platform here, they get touched 17 times. 17 times. Think about that. 17 times. That's how you have retention. Okay? You have to continue to have relationships and conversations with your clients. And this is one hack in order to do it. If you're not doing this, or if you're not signed up for these services, please make sure you do so. You can reach out to the team and we'll get you set up. Yeah, we'll get you going there. But the other part of it is just the support tickets that are available on here too. So if you have an issue with one of your clients, you can go ahead and click support, and they'll take care of the rest. Just follow the bouncing ball in there, and you can sign up a ticket. They've got all sorts of different help strategies and things like that. So that's in the help center here. Again, it goes through all of that. So if you're going, you have more questions about client services, they've got videos, they've got, how-to guides, they've got everything here as far as how that works. Client retention, we just talked about that, and all of the different things that are going on there just by getting set up with this program. It's very, very easy to do. Those agents that have jumped in early are seeing massive success with their retention. So excited about that, and very happy to see their growth in their book of business and their retention just skyrocketing. So very cool. All right, moving over to NABIP. Many of you have heard me talk about NABIP in the past. This is the association that I am a part of, and many of our team members are now starting to be a part of this. And this is an advocacy group for independent agents. You are an independent agent. You should highly consider joining NABIP, okay? There's lots of information, lots of moving parts that are happening in this industry. And as of right now, Health Plan Markets has the best discount to join NABIP Central Florida. So there are other chapters. I just want to let you guys know that. So if you're not in the Central Florida market, that's okay. Reach out to us and we'll connect you to the chapter that makes sense to you. I know we got a few folks in Tampa that joined. And then we got some folks joining here in Orlando as well. I also want to point out that their annual convention, Florida convention, is happening on June 28th through July 1st, and you can register at nabip.org. I will be there, and I'm waiting to hear back, but I might actually be speaking at that event. So if you'd like to see me live in person, to boo and throw tomatoes at me, now's your chance. So I'll be talking about, if I get chosen, I'll be talking about lead management, actually, which is another subject that we're going to be broaching here very soon. But as you can see, you've got lots of great things happening, virtual workshops, Medicare information, sales. I mean, it's just unbelievable, all the stuff that they put together. I also wanted to point out the Central Florida website chapter here. And I know Dave's watching me. He's on this call here. He's the man with the plan. So nabipcf.org, you can check that out as well. But if you're wanting to get started with NABIP, shoot us an email at support@askhpm.com so we can send you the application. Our application has an automatic discount for you. If you sign up direct, you're not going to get the discount. I'm just letting you know that ahead of time. You're more than welcome to sign up direct. It doesn't matter to me. I'm just trying to help you guys out. You know, the discount is exclusive to HPM for now. So take advantage of it because it's not going to be there forever. I did see Bruce Williams. You're on the call. Thank you for joining. Appreciate that, buddy. I saw you at the last event too. And he's starting to see, a little bit of that. So, all right. If you are in other areas, they have a chapter website here And I'll put that in the chat just in case, but you'll find ours there. If you go down to Florida, Central Florida, Orlando, right there, makes it easy for you all to get to where you're at if you're in other parts of the world. So, all right. Whew. It's been a while since I've been talking. So with that, I have a special guest on the line, and I'm going to set him up as a presenter. I actually see him on here twice. I'm not sure how that happened, but we're going to assume this one is the one. There he is. So Ben Harrison of NCD is here to talk to you guys, not only about the dental plans, but all the ancillary products that that we have hooked up with them. And it's been a while since we've hooked up with NCD, but we're making a huge push internally with ancillary products. We've talked about this before. Let me see if I can give you the mic here, Ben. And so Ben's gonna talk to you about NCD, give you the good news. And one of the major points I want to make is their products are already on HPM Shop. They're already on Connecture. They're ready to go. You guys just need to learn about the product, get contracted, and then he's going to share some trainings that are going to be coming up soon, and we're going to constantly be adding those trainings onto our calendar moving forward. So, Ben, take it away, buddy.
Okay, can you hear me?
Good to go.
All right, great. I hope there's enough feedback.
And by the way, he's doing that. He is on the West Coast, if I remember correctly, and it is very, very early there. So he gets bonus points. We're gonna send him a little something in the email or something. We really appreciate you getting up early, Ben.
Yeah, no, it's no problem. I'm happy to do it. Okay, so this is the first time I've used this.
Take your time. I know. Oh, you know what? Let me stop sharing. That might help too. Oh, no, I did. Okay, so you should be good to go.
Cool. I'm gonna try and share the screen here. Great. You guys can see that?
Good to go.
Cool. Okay, guys. Excuse me, Justin, thank you so much for the intro. Folks, I really appreciate the time. I don't want to take up too much of it. I do want to make sure that I'm adding some value here and things interesting. So I'll just jump in quickly and try and give you a high-level overview here. So like Justin said, my name is Ben Harrison. I'm the Chief Revenue Officer here for NCD. NCD is an ancillary carrier, right? So we provide products in the supplemental and ancillary space. Right now, we're talking about dental, vision, hearing, that's embedded in the plan. So really kind of topical to your clients, what they're thinking, what they're talking about today. So just to set the stage, the NCD as an organization, we exist to improve lives, driving better health, exceptional experience, and what we call spreading the smile, right? So we work really hard to engage both our members and our agents on quality product with a unique benefit design that solves problems that they are facing today, right? And so I'll talk about that a little bit more here in a little bit. But basically what we're doing is we're building these innovative products with benefits that don't exist anywhere else out in the market, with an intense focus on exactly what our members need. We're generally focused on the senior market. This is a place where we've played for a number of years. As you guys know, seniors have a unique need. Their dental and vision insurance coverage, they typically more care that they need. The average member, things like more teeth cleanings, more intense services like implants. So we want to build our products with that in mind. And then we know that we're agent driven as well, right? All of our sales come from our agent partners, our broker partners. To that end, we're members at NABIP, just like Justin was talking about. I do think that joining NABIP is a great idea. We're there for a long time, more than a decade. And we want to be in the place where agents are. So to that end, just like Justin was saying, we're integrated on HPM Shop. We were actually the first ancillary carrier who was integrated there as well. All of this is supported by this, again, this kind of member experience, right, that is equal to none, right? So our members are happy to be enrolled in a carrier that is the highest rated and reviewed insurance carrier in America, right? So not only the highest rated and reviewed dental insurance, health insurance carrier, if you go onto Google and you Google Dental and Vision, something you're doing right now, you'll find that we've got well over 5,000 reviews just on Google, with 4.9 out of 5 stars. We're also on the Better Business Bureau and through Shopper Approved, host of other rating and review platforms. These are all 100% organic reviews, our members going online proactively and talking about what a great experience they have with NCD. We know that when our agents and brokers enroll their client into an NCD product, it's usually not the first or the only that they're enrolling that member with. And so we have responsibility not only to our members, but also to our agents, right, to provide the best possible member experience so that we're being purely additive to your business, not only from a fiscal perspective, right, by paying commissions, but also from a relationship perspective, right, by really doing something unique for your members or your clients rather, and solving real problems for them. Like I said, we are already integrated on your enrollment platform, and so it should be very easy once you're contracted and set up to get folks enrolled, thereby reducing the total number of clicks, rekeys, and all that stuff. You don't have to go through multiple distinct application processes. It should all be built into the process you're using. Cool. I'll jump into a little bit on product design specifically. Like Justin said, we'll be working to set up specific trainings for your group here later this week and next week, so that you folks can access more detailed information both on product design and enrollment process. But in the meantime, I'll say that our products, or dental products, are all underwritten and supported by MetLife, right? So that's important to call out for a couple of reasons. One, it means that we use the MetLife Dental Network. And so that's one of the largest networks in the country. It's in all 50 states. We have 400,000 access points. So a lot of options for folks to use. Really, really rich network in the state of Florida in particular, where I know you guys have a lot of folks located. We also have our dental products in 43 other states. We're in 44 states total on dental. Our vision program is in an additional 5 states, making it 49 states in total. The product we're just missing in the state of Washington. We'll get them nailed down here in a little bit. So again, the way that we build our dental products is basically like all of your expectations plus a little bit more. So it's all the benefits you're used to for covering preventive, basic, major services. We have day one preventive, basic, and major services, and we have different benefit tiers, right? Our most popular plan is our MetLife Complete plan. It's also our richest as well. So that plan starts at $75 a month for an individual and is the strongest benefit design in the dental insurance space on the individual market today. So like I said, day one coverage on preventive, basic, and major services. It covers cleanings 3 times a year rather than just two times a year. And it has a $100 lifetime deductible on the plan rather than annual deductibles, right? So you just satisfy that deductible one time and satisfied for the rest of the lifetime of the policy. And then annual maximum plan is actually $10,000, and the plan also covers implants, right? So this plan is really designed for a senior client who knows that they're going to have some impending dental care sometime soon, right? It might not be today, might not be tomorrow, but sometime in the next year, 2 years, 3 years, they know they're going to have some dental care that they need, as frankly most seniors will. We cover up to $10,000 per year in that plan. So it's a really, really good design. And again, the premium starting at $8 a month is pretty affordable, especially at that tier of benefits. We also have plans starting at $29 a month. Those are our new break plans. So again, there's definitely more affordable products out there. We have Medicare Advantage clients who are a little more cash sensitive. Being Medicare Advantage, this is really one of the reasons why we are so strong in the senior space. Of course, the strong benefit design makes a difference, but over the last few years, we've seen pullback in embedded Medicare Advantage dental benefits, right? And so we see that our members are going through Medicare Advantage enrollment and expecting some kind of dental coverage to be in there. Sometimes there is some limited dental coverage, sometimes they're not. So our agents are present these products really at the point of sale or in a follow-up call to say, I know that dental is kind of a minimum expectation for you. Fortunately, your plan of best fit in the Medicare Advantage market may not cover dental as well as it used to, or may not cover it at all. And so this is a solution for you. In fact, what we saw this year is 50% of Medicare Advantage plans today not covering dental insurance, and we're expecting that trend to continue this year, right? So that is all the indication that we've had from our carrier Medicare Advantage space is a continued in Medicare or in Medicare Advantage, excuse me. So to that end, it's a really great solution for our senior clients who are already on Medicare Advantage plans. Further, for our agents, where they've seen commission compression in the Medicare Advantage space, pullback commissionable plans in Medicare Advantage and PDP. This is a really great solution to help round out your business by diversifying not only on the product line by offering more ancillary supplemental products, but also diversifying on carriers as well, right? So we're not covered by the Medicare Advantage space. We don't offer the Medicare Advantage space. We don't have to deal with the filing and refiling every year. We are simply to excel and offer world-class plans in the ancillary supplemental space. Our vision plan is underwritten by VSP. And so again, it's a really strong network for folks who are on those plans. And again, similar benefit design where it covers all the kind of basic stuff that you're used to, right? So we've got copays on exams, materials. We have a $200 frame allowance. But where our plan really sings is on progressive lenses. So we found over the years that our most popular discount that was used on the plan was for progressive lenses. And those are kind of embedded by lenses, lines, or anything like that. We are now offering $50 copay on progressive lenses. So if you're at all familiar with the cost there, premium progressive lenses often range in cost from $150 maybe $200 for a set of lenses. We offer a $50 copay, which means that if your clients are actually using the progressive lens benefit, they pretty much net out equal on premium and cost savings just by using that progressive lens copay. So again, it's a really benefit among our membership. It makes a lot of sense for clients who use it. Member care. I mentioned we are, like I said, the highest rated reviewed insurance carrier in America. This is part of the reason, right? So we are actively engaging with our members as soon as they get enrolled in our plan and through their entire us at NCD. We're generating 1,000 welcome calls every month. We're engaging with our members both on the phone and via email, but also text message. The point is that we want to be where our membership is, right? So if they're comfortable talking on the phone with us, we want to talk on the phone with them and address whatever questions or concerns they might have. If they prefer to text back and forth, which a lot of seniors do, we're happy to do that as well, right? This really started as a way to support our agents and our brokers to say, you've done the dental insurance enrollment, right? You've got your hands full in your Medicare Advantage business, or your Medicare Supplement business, or your CA business. Let us take this lift off of you and help address these client concerns and questions that pop up from time to time for you. And so the first thing that we're doing when somebody's getting enrolled is we're generating an outbound call to welcome them onto their CD plan. We do a few things on that call. One, we're addressing any kind of network questions. We want to verify that their provider is in network. And if not, then we can help solve that problem as well by setting up with a new dental provider or talking about the process to get their provider in network. Again, the MetLife network is very pervasive and easy to use. And then two, we want to prepare them for their next dental visit. Often we find that our senior clients or senior members maybe haven't been to the dentist in a while, right? And so we want to empower them to expect when they get to the dentist. both questions that the dentist might ask them, and also questions that they could ask their dentist, right, in order to get prepared for that first visit. What we find is that usually there's some kind of hidden objection with a lot of our senior clients, where there's some reticence about getting back into the dental office, or getting back into the regular maintenance of twice yearly or 3 times yearly cleanings. And so we want to help address that. We want to make sure that they're feeling calm, comfortable, and really using the. We also hold ourselves to very high standards, not only on our member care side, but also for our agents, right? So, world-class member service is really only the beginning of it. We want to help you drive your own book retention, right? What we know is that members who get enrolled at one product in a sale, they'll often stay longer if they enroll in multiple products with you, right? So if they're not only your Medicare Advantage client, but also your dental client, vision client, et cetera, we'll generally see that rising tide lift all boats, right? To drive member retention for you across all of the clients. Further, if you have any questions or comments or concerns that you need help with, we are available for you. We have a 100% agent call service level. We're answering in 30 seconds. So our average speed to answer is 18 seconds. Like to remember care line during business hours. And then we're at 99%, 100% on email response in 2 hours. So again, if you've got questions, no matter if it's lock-in or AEP, if you email us on October 15th, December 7th, we're going to get right back to you in order to address those questions. All right, folks, that's my rundown. Like I said, we'll be working with Justin and Nick and team to be setting up more training and education for you. If you have any questions at all, don't hesitate to text me. Don't hesitate to email me. I am available. I am usually up and working at 6 a.m. Pacific time, so this is not at all unusual for me. And then we've got a team of folks, a lot of which are in the Southeast, that can help out as well. Thank you all. Justin, thank you for your time. And looking forward to working with you.
Well, before I let you go, you hit on a lot of great things here, and just to kind of close out, thank you for being here, first of all, and this was very high level, but you can obviously see the huge value prop that you have for your Medicare clients, and you had talked about the reduction in dental and vision benefits across the country for Medicare Advantage. And we just witnessed this happening over pretty much the last 2 AEPs. And I hear it all the time. These guys are on the call right now, and they're like, I'm tired of chasing my book around because Plan X dropped their dental, or Plan Y reduced it by $1,000, and now I got to flip my business again. And so can you talk about, some of the strategies and retention that you see, maybe other agents that are using your product and the successes that they're having?
Yeah, absolutely. So one, you're exactly right on the pullback in benefits. And two, it's important to note that not only is that anecdotal evidence, right? We hear agents and brokers talking about it. We hear clients talking about it. Deft Research actually has a large swath of research about this, right? So what they'll tell you if you go to them is embedded benefits are important to members. The one that they care about the most is their embedded dental benefits. It is also the one that drives the most friction in their Medicare Advantage clients, right? And so not only are our clients really, really interested in it, they're generally not having a good experience when they go to use these benefits under their Medicare Advantage plan. And of course, that's driving some of the carrier decision making on the Medicare Advantage side. It's causing them to pull it back. There are a host of other reasons as well. And not least of which is these plans were not optimized for deploying dental and vision benefits and all of the other benefits. They're really optimized as healthcare plans, right? That really play in the doctor and hospital space. So that's important to know. Two, just like you said, 2 AEPs ago, according to Deft, we saw about 90% of Medicare Advantage plans using some amount of dental benefits. Last AEP, it was down to 50% of total Medicare Advantage plans, and this is across the entire US market. And then this year, the tea leaves conversation happening with a lot of those carriers is that's going to reduce as well. So that causes gaps in the plans and gaps in your client expectations, right? The most successful agents that I've worked with really acknowledge and embrace gaps in the plan, right? So you're going through your shopping experience with your Advantage client, and you're walking through the doctor and pharmacy lookup tools, and you're finding the things that are best for them, and you're going to find a few different Medicare Advantage plan options that cover them really, really well. And to some extent, there's going to be some gap in dental vision coverage. They may cover $500 a year. They may just preventive care, or they may not cover it at all. And so while you're going through your benefits explanation, right, we find that it makes a lot of sense to just say, okay, Mr. Client, this is one of the best plans in the market for you. At the same time, I want to make sure you understand that it really does not cover your dental care very well at all. And dental care is the start of your overall health, right? It is the way through which we really manage healthcare in America. It's the most frequent healthcare provider that you see on a regular basis. So we know that it's important. We know that it's to you. And so if we want to make sure we're really covering your dental care well, I've got a host of options here also in the platform, right? And one is NCD. You mentioned that you're going to have folks with Cigna, United, right? United, a lot of those guys, they offer great things as well. And so then you can have a more robust conversation by saying, I know it's important. This is not the way we're going to solve it through your Medicare plan. And in fact, it's going to get worse over time. So let's just take the opportunity to really parse it, have a detailed conversation about your dental care needs, what you've experienced over the last 5 years, what you think you might experience in the next 5 years, and solve for that in a way that's going to really present both your health and your financial situation. Does that make sense?
Oh, totally. Yeah. And, to add the caveat on, research shows that if you have one or two or more products with the same client, 2 or more products, your retention increases by 25%. So just by having one additional product like NCD tacked on at the same point of sale, by the way, it takes an extra 30 seconds to run a quote on Connecture,
Yep.
right? And then just have that conversation. So it's really about tailoring your conversation about when you hit that dental part of Medicare, say, hey, look, it's got some dental benefits here, but I'm going to show you something that's way more robust than this. And it's just a few bucks extra per month that I think is really going to make it worthwhile, especially if you've got a give back plan where they're getting money back. You can say, hey, I gave you money back, and now I'm going to take a little bit of that to really increase, your coverage on dental and maybe even the vision coverages too. There's a question in here, Ben. It says, do any of the NCD dental plans cover orthodontics? And is there a waiting period for that?
Question. So I'll answer 2 things. One, at the moment, we're not covering any orthodontics, right? So we really are doing these plans towards seniors. We find that orthodontic coverage really kind of gears the plan to a lower age. And then 2, we generally steer clear of waiting periods, right? So almost always we don't have any waiting periods in our plans. They're really focused on getting and delivering care day one if you need it, and then accelerating it over time over the course of 2 and 3 years. So just as a rule.
Awesome. Let's see here. Direct contracted with NCD. Should I be contracted through HPM? If yes, why? I guess Mary, I guess, had contracted already with NCD, and she's just wondering, does it make sense to partner with us on that?
Without a doubt. I mean, I'll jump in and just, I'm sure you have your own thoughts, but I would say yes, and for a host of reasons, right? One, the actual process of switching is very simple, very easy. Mary, if you call in or email our agent support group, we can get that done pretty quickly. But then 2, it's all about, from my perspective, I started as an agent. I didn't go into that, but 15 years ago, I was an agent, and just having all of your tools and processes in one place, so that it's just really easy from a process and operational perspective, allows you to scale your business much more easily, right? I think, and the reason why, Justin, we really like working with you guys is bring everything integrated into the enrollment platform, so you can quote and enroll super easy, all in one call. Like you said, it just takes an extra 30 seconds rather than navigating the platform. That I think makes dividends. And so that's just my 2 cents.
No, I appreciate that. And I don't think there's a loss of commissions either, Mary. So you get paid exactly the same. So it's just a matter of us, managing those things. Looks like there's another question. Can we have MetLife marketing materials and including a stand-up banner. A lot of these guys are doing community events and they're out there in the field. So Jose's asking, do you have any of that stuff that we can kind of set up?
A ton of marketing materials. Yes.
Okay. Awesome.
Yeah, we got a lot of marketing materials. Our dental materials will be co-branded in CD and MetLife. You know, we know that our members love the MetLife brand. So I didn't talk about this before, but it's also worth noting MetLife is the largest dental claims payer in America. They are the largest large group dental plan provider in America, but they don't play in the individual space at all, right? So we run their individual program. So what you'll find, especially in the retiree population and folks who have just retired recently, is that they've often already on a MetLife or they've been on a MetLife within the last couple of years, which makes the network search really, really, right? Because again, we're using the exact same network that they use in group plans. There's no network switching or anything like that. And so that makes it really easy to make sure that their dental carrier or provider rather is still covered. And that's another place where on the Medicare Advantage, vetted dental benefits, like maybe the benefit design is there. Often what they'll use is these really narrow regional networks that carve out most of the dentists in the space. And so it's just another one of those places where Medicare Advantage has a hard time. Individual makes a lot more sense. Just a true standalone individual dental plan makes a lot more sense.
Yeah, and like we were talking before, you know, if for whatever reason your client does have to switch to the Medicare Advantage plan, the NCD is still there. That's one thing you don't have to move or mess with every year in AEP. So, you know, it should bring some stability to your book of business. And if they do have to change, you know, that doesn't impact the dental portion or the vision portion, whatever else you added onto that, as far as the ancillary is concerned, which makes you a better agent, really. And that retention part of it is massive. I expect, and here's the biggest strategy that I would say to you guys that are on this call right now. And thank you guys for staying overtime. By the way, Ben, anytime that we have overtime like this, it means it was a good call. So like,
okay. I'm sorry. I'm sorry. Yeah. I mean, keep you long.
No, this is good. This is good. So those of you that are on this call, I challenge you to call every single one of your clients, every single one of them, because it's lock-in now, right? Like there's no I mean, it's very few Medicare sales. Some of you are still out there fishing, and that's great. But this is the time to really build those relationships with your clients. I challenge you guys, get contract with NCD, go out there, call each one of your clients and talk about this product. So when open enrollment comes around next year, you're not having to chase your book again for these dental plans that are just going to flip again. So we're doing this as a favor to you. So you don't have to chase your tail again this AEP and really lock in your book of business. And NCD is the product that we feel is that way, that solution, that formula that I think is really going to make sense in what we do currently.
Yeah, and Justin, I know you said we're over time, so I'll try and make this quick. But in that conversation, you can just ask if they've had an opportunity, if they have embedded dental on their MA plan, which you should be able to see pretty quickly, if they've had an opportunity to use it yet, and just find out what that experience was. And maybe it was great, and maybe it doesn't make sense to upset the apple cart at this point, but oftentimes it wasn't. And what I think about as like the real superpower of brokers, right, is that your clients can go out there and maybe they have some embedded dental coverage and maybe they don't. They're going to have some kind of tooth pain, they're going to have some kind of issue, and they're going to Google, right? And at that point, then they're exposed to the whole information, right? And information is cheap, right? They're going to get inundated with banner ads. They're going to get direct mail just from the Google. They're going to start phone calls. You offer curated information, right?
Yeah.
Information that has an extra layer of fiduciary responsibility, an extra layer of licensure and accreditation, and education. And that's where you can start and really your opportunity to shine, to really offer value to them, so that when they're getting the email dental discount programs that may only cost $5 or $10, but don't really cover anything, you can have an educated conversation and say, like, you can look at that. Here are the risks, right? Is that it's not going to cover much, you're not going to be able to use it very well, or you can actually enroll into a dental insurance plan. And let me explain to you this, right? And that's where you really get to deliver value and you're really solving.
Yeah, amazing work. Ben, thank you very much. I'm not going to hold you up, and I know it's super early there. I really appreciate you getting up. And I was like, like your shirt that you're wearing, it almost looks like pajamas in a way. So maybe it is
No,
like
it's a real shirt. It's a flannel shirt.
like dress pajamas. I was like, I got to get me a pair of those, like whatever he's got right there. But and by the way, guys, if you didn't pay attention, he is the chief revenue officer. This is the money guy. This is the guy you want to be friends with. Okay, so if you didn't pick up on that, that's important. He dropped his email and phone number. But guys, really consider NCD. If you want to get started, shoot us an email at support@askhpm.com and we'll get you rolling on the contract. Ben, thank you very much for being here. We really appreciate you, man.
Thanks, guys.
You
Bye.
got it. Take care. Everyone else, we'll see you on Monday next week. Same time, same station. Enjoy your week. Just a reminder, guys, this Friday we will be closed for HPM's birthday, so we won't be here, but we'll be on call if you need us. Thanks and have a great week.